Hello, Assalamu alaikum. This is Amani Shahabildin. I'm occupational therapist, specialized in burn rehabilitation. Today I'm going to talk about how to use cobaning as a very early intervention of burn hand management. Coban is a very useful and very essential material we can use after 10 days of skin graft, after you are sure that the skin graft was taken. I know there is always some patchy, small open wounds around, so wound care, skin care will be done as usual, and then good Gelinet with Ficidine, and then you can use extra padding if the graft is a bit fragile. You can apply some other padding if you have like 1 millimeter thickness sponge, Spinco foam, any of those materials. You can apply it on top of the Gelinet. And if you notice, the way you are holding the cobaning, the roll should be facing up, so it will be easily applied and loosened. So you start from IB joint, and then you can have 1/4 of the stretch of the cobaning distally, like that. You can see the tip finger, you can leave it open unless there is amputations. This is the only time you can cover it with cobaning. So coban is self-shrinking material wherein it will apply more pressure once you leave it on. You can do cobaning daily or every other day, and this is depends on the wound under the cobaning. If you are not really trusting yourself about holding the roll itself, you can cut like 40 centimeters of coban, and then you can go. So you will start diagonally on the tip finger, and then after that you continue in a spiral shaping. The meeting point of the cobaning should always be in the middle, so you are sure that you are applying uneven pressure. Because if the pressure is not uneven, so you will have some areas of maybe fluid leakage or something in between. You can see on the IB joint, and then 1/4 stretch, and then a spiral meeting at the middle. Once you are finishing now with all fingers, so once we finish now all fingers, we'll come to the very important part, which is the connection between the palm and the fingers. And to be sure that you are doing it correctly without leaving any open spaces in between or gaps in between, so you will hold cobaning and you will apply 1/4 of the width of the coban on the palm, and then 3/4 of the coban on the fingers. In that case, you will need to hold the whole roll. As I mentioned before, you need to get the roll facing up. If you stretch the roll of the coban, you need to put it back, so you will not apply excessive pressure. Now you can see also spiral shape after that, without applying any tension on the material. Now you stretch to get more cobaning, and then you get it back, and then you continue the whole hand. Now you will get the thumb included till you go beyond the wrist. So the wrist fold should be covered as well, so once patient is moving, it will not irritate him. If you are not really familiar with wound care, of course, nurses will do the wound care for you, and then you will do the cobaning after they finish the wound care. So they do the wound care with the layers of Gelinet or whatever, and then you can have, if you don't have like a padding material, you can use silver cell on top of the Gelinet, or even goes 4x4. You can apply it on top to apply like a padding under. Now you cut the excessive cobaning in between the web spaces. Now you will do the interdigital strips, and the interdigital strips are very important. First, it will not allow leakage of any fluids in between the fingers because you are applying pressure. Second thing, if you have burn in the web spaces, you will not end up with scar formation and then syndactyl deformity later on. Vertically, with cobaning, you can stretch it with no problems, because vertically you will not affect the blood circulation. Now with web 1, you will do wider cobaning, so you will not slit the coban, and then stretch and then hold it in between the thinner and the hypothinner. Now we finished almost with applying the coban as a glove, but also with those interdigital strips, sometimes patients will play around with it and then get it, remove it, especially with pediatrics. This is another correction, like if you have a flexion deformity in the IB joint, this is how to use cobaning as to correct the deformity. So you stick half of the cobaning on the tip finger, and then you stretch it on extension, and then you get the other part of the cobaning parallel to the previous coban, to the previous stretch, so you will get more extension in the BIB joints. And this is very useful if you are having a claw hand. Now in the other little finger, I've used it in case you have ulnar deformity. Now to secure your work, this is what I mean by sometimes pediatrics just pull off the interdigital strips. So I will just do a small piece of cobaning as to secure my work. So without any pressure, you will just roll the cobaning like that. You can see I'm leaving it loose. And then now I'm done. Now I need just to keep giving some pressure around, so to be sure that the coban sticks very well to each other. And this is the way you apply it as a